Island schools tackling the flu outbreak. We are now into the third week of school vaccinations. Today, 16 schools are on the list, some hosting a clinic during class. Others will give out the vaccine after school. Some of those on today's list include East Providence High School, James Eldridge Elementary School in East Greenwich, Western Hills Middle School in Cranston, Birch Vocational Center in Providence. And to see which schools are giving out the vaccine tomorrow, you can go to our website, abc6.com. We have all that information, including a printable parental consent form. Look for it under the flu outbreak section. And we are still receiving emails from you at home asking questions specific to your situation about the H1N1 virus.
As long as your emails keep coming in, ABC6 will continue to seek out expert advice to help answer some of your questions. Joining us today on ABC6 News first at 4, Lisa Zapatka, Vice President of Patient Care Services and Chief Nursing Officer for Landmark Medical Center. Lisa, thank you so much for coming in today first at 4.
My pleasure.
Good to have you. Well, it's very simple. Alison and I will read an email, and if you could respond to each one individually, that would be great.
Okay.
The first one coming in to us from Mary. It says, my child is scheduled to get the H1N1 vaccine at a school-based clinic this week, but she is running a fever. Can she still get the vaccine even if she is already sick?
Well, the best advice that I can give Mary is it's important that she call her pediatrician, because I believe the last thing that you want to do is bring a child with a fever into school for the vaccination program. Generally, we don't like to give vaccines when anyone is running a fever because we want the vaccine to be as efficacious or work and do the work that it should do. So the best thing for her to do is call the pediatrician, and hopefully maybe her child's fever will break before the school scheduled for the vaccines, and then it would be okay for her to receive it.
An ABC6 viewer by the name of Scott asks, is the H1N1 virus a reoccurring virus like the seasonal flu?
Well, right now, the best information that I can give Scott is we really don't know. We are getting reports, actually good published reports from the Southern Hemisphere and their experiences with flu, their past season. But right at this point, we can't tell whether this will reoccur next year or not.
Nancy from Lincoln writes in and asks, is the swine flu virus at its peak right now, or will the outbreak get worse over the next couple of months?
Well, ironically, Nancy, I think what we're experiencing now is the downtrend of the flu, and we're seeing less activity in the hospitals right now. But I will tell you, based on the information we've received from published reports as well as from our Department of Health, we will see a lull over the next few months, but we are expected to see another phase around the month of March for another upsurge of flu activity.
All right, Lisa, we're going to take a little break with you right now. If you could just stay with us. In a few minutes, we'd like to bring you back and ask you some more questions related to the H1N1 vaccine. So if you could stick around, that would be great.
Joining us today first at 4, once again, is Lisa Zapatka, Vice President of Patient Care Services for Landmark Medical Center and the Rehab Hospital of Rhode Island. Thank you so much for sticking around and answering these questions for us, Lisa. We very much appreciate it.
Lisa, we've received dozens of emails from concerned viewers that people want to know, how are patients with the swine flu symptoms being handled when they come into emergency rooms?
Well, what I can tell you, especially from Landmark Medical Center's perspective, we have a greeter within the ED, and what we've done is we've separated our ED waiting area for patients with flu symptoms and patients without flu symptoms. So when an individual comes into the emergency department, he's met by the greeter. The greeter will ask what brought him or her to the emergency department, and if they are an individual with flu-like symptoms, we offer the patient a mask, have them wait in the flu-like symptom area of the hospital, where we have a separate registration and triage patients so that they're separated from the other population within the waiting room.
And have the hospital bans do they seem to be working okay?
Absolutely. To be honest, the community has really been very cooperative with the age limitation that we put on visitation, and to be honest, we didn't even have to move to restricting the hours of visitation because it has worked so well. Our staff are very good at screening individuals when they come in, and they notice that if someone particularly has a cough or a cold or a runny nose, they'll ask the patient to wear a mask or to leave the area. And I have to say, people have been very receptive, so it really has worked out well. And I think it's helped that most, if not all, Rhode Island hospitals adopted the same type of limitations within their organizations.
Lisa Zapatka, thank you so much for joining us today. First of all, we appreciate your insight.
Thank you.
All right, ABC 6.